Thank you so much for that introduction. Hello and good afternoon, everyone. First of all, I would like to thank the Times Group, the Economic Times, and the ET Edge for organizing this crucial summit, where accomplished individuals from across the globe are uniting for a common purpose to share ideas on how we can rebuild our world better after COVID-19. I'm truly happy to be a part of this commendable effort. The current pandemic has presented to the world one of its biggest challenges in human history. The costs of COVID-19 have been enormous, and we still do not know the full extent of the damage. There has been loss of lives and livelihood. Close to 1 million people have died across the globe, and hundreds of millions have been rendered jobless. The global economy, as well as the Indian economy, has shrunk. Along with these well-known stats, there are some little-known ones as well. As health services gear to attend to COVID-19, routine health services have been disrupted. In India, there has been a drop in immunization of children and maternal health checkups. Similarly, there has been a decline of people screened for HIV as well as for treatment of diseases like TB. And all these, as we know, will have a long-term impact on India's public health. Schools, colleges, universities have been shut, affecting around 320 million students across India. While classes have moved online, a large number of students with no access to computers or smartphones have been left high and dry. As per the 2017-18 National Sample Survey, only 23.8% of Indian households had internet access, with numbers dropping to 14.9% for rural, effectively rendering more than 3/4 of the students out of the education system. To add to this, I believe we are on the cusp of the biggest global mental health emergency in recent history. The effect of the coronavirus pandemic on mental health will be bigger than anything that we have seen before in this world. This will not just affect frontline health workers, patients, and people who have lost their jobs, but a larger section of people across the spectrum. In this context, the Sustainable Development Goals that the world adopted in 2015 have become more important than ever before. It is true that the current pandemic has affected the progress made so far in SDGs. However, it is also true that it gives us all an opportunity to press the reset button and shape a new post-pandemic world which is more equitable and sustainable. I firmly believe that a rigorous implementation of SDGs can put the world and India on a sustainable path to recovery from this pandemic. Let me focus on two core areas: education and mental health. Let's talk about education first. India, as we know, has made a lot of progress with regards to SDG goals in education. We have seen considerable improvement in implementing education for all. There has been growth in enrollment rates as well as student retention, which was actually the larger issue. However, several challenges still remain. Learning outcomes continue to be one of the biggest challenges. The annual PISA test and the ASER test, ASER, have shown a large proportion of children in India do not meet the level of learning outcomes prescribed for their respective classes. Private schools are expensive and not everyone can afford them. In fact, 65% of Indian students attend government schools, the foundation that enables the education of masses in India. Therefore, there is an urgent need to strengthen India's government school system. We need to empower not only the students, but also the teachers and modernize the system drastically. Quality and equitable education, however, cannot be achieved without a sound education policy. Of course, now, after nearly 3 decades, the new education policy has been introduced in 2020 with the intention of transforming the future of the children and the youth in India. And in line with principles of SDGs, NEP 2020 is based on 5 pillars: access, affordability, equity, quality, and accountability. It will follow a 5+3+3+4 system instead of the traditional 10+2 system. And it will focus on critical learning and vocational skills rather than rote learning. It will offer students multi-stream flexibility along with the academic bank of credit. and with greater emphasis on the training of teachers to equip them with the skill sets required for a 21st century education. NEP 2020 is really looking to revolutionize the educational system in strategic phases, and which is exactly what we need. If it succeeds in its goals, we will come much closer to accomplishing Goal 4 of our SDG in the years to come, and this will have an overwhelming impact on the socio-economic fabric of our country. The COVID-19 experimentation has shown us the pros and cons of the online model of education. What we need to do is to take the positives and enhance them so that more and more students can benefit from it. As far as the cons are concerned, there are always solutions that we can seek. To quote Richard Bach, "There is no such thing as a problem without a gift for you in its hands." For example, I spoke about how 3 out of 4 students have been rendered out of the education system due to the lack of internet access. The solution therefore lies in stepping up the digital infrastructure and making the internet accessible in every nook and corner of the country in an affordable manner. By doing this, we would assist in accomplishing several other SDGs as well. Goal 9, innovation and infrastructure. Goal 10, reduced inequalities. Goal 11, sustainable communities. And Goal 17, partnerships for goals. It is clear, however, that if India has to make an accelerated progress towards its SDGs on education, technology, and online learning will have to supplement the offline models in the future. Banka in Bihar is one of India's most underdeveloped districts, but we're seeing some great work which is already showing promise there. Some years back, an experiment was launched across 143 government schools in the district. From Monday to Saturday, students of Class 10 were made to watch videos and slides cast on a television screen for various subjects like science, math, etc., for almost up to 90 to 120 minutes. And at the end of those interactive sessions, a daily short 5 questions test is conducted, which was then followed by weekly baseline tests. All tests were uploaded, and that data was accessed by parents, students, as well as district administration officials. And there we realized that the learning outcomes improved from 17% to 54%, and the attendance grew to 90%. The Unyan Banka initiative now has been recognized even internationally as a significant innovation in education. Therefore, community, we realize, plays an important part in the education system. Active involvement of the local community in education will be a key in achieving our SDG goals for education. As a nation, we really need to focus on providing education for children with different learning or emotional needs as well. It is sad that in India, only 55% of people who are differently abled are literate, and 34% of children with special needs are out of school. The solution, therefore, is to have more inclusive education programs to overcome these impediments. Thankfully, these are also planned in the provisions in NEP 2020 for a barrier-free access to education for those who are differently abled as well as those with special needs. The teacher education programs will now focus on imparting knowledge on how the children should be taught. The children themselves will be given the choice of special needs schooling. It is truly commendable that NEP 2020 has been aligned with the Rights of Persons with Disabilities Act. At Empower, which is the mental health initiative that we run, we've just launched the Minds Matter program, a mental health curriculum for grades 1 to 12 for schools across India. Let's now move to another very important area of focus, which is mental health. So around 5 years back, my daughter Ananya and I discussed the need to create a paradigm cultural shift towards acceptance of mental health concerns in India. And we decided that it is time to bring up this issue up in the national consciousness, and thus we founded Empower. Since its inception in 2015, Empower has been a pioneer to the Indian mental health care arena. Our mission is to empower individuals and their families with mental health concerns by creating awareness, alleviating stigma, advocating prevention, fostering education, and providing world-class holistic services so that they may lead meaningful and productive lives with respect and dignity. Coincidentally, in 2015, 3 years after the Rio summit, The United Nations also included mental health in the Sustainable Development Agenda. Unfortunately, that is an area that needs a lot of work to be done to get mainstream national consciousness. There are an estimated 130 million people in India with mental health issues, more than the combined population of France and Italy. This number is bound to increase as the country grapples with the current pandemic. Despite the large burden of mental illnesses, only 10% of Indians with mental health problems receive evidence-based treatments, thus leading to a huge treatment gap, probably even greater than 70%. India's spending on mental health has consistently been inadequate. India has one psychiatrist for every 300,000 people and one psychologist for every 15,000. Even from the government perspective, the issue has not received the deserved attention. The National Mental Health Program has been allocated a mere 40 crores in the 2021 budget, which actually has been reduced from 50 crores, which was allocated in the 18-19 budget. Mental health really needs to become national priority. India needs to urgently overhaul its national mental health program. There needs to be a significant government investment in improving mental health services at the level of primary health centers for the training of psychologists, so that we're able to reduce the treatment gap and the inequality in treatments. What is required is an integrated approach that involves government, the private sector, the NGOs, as well as the community. There are separate examples from across the world that India can learn from. In Australia, for example, the government is investing an extra $500 million in funding for mental health and suicide prevention during COVID-19 pandemic. Similarly, many other countries like the UK have chipped in with additional funding for tackling the mental health crisis. On a long-term basis, Western Europe has done good work with a community care-centered approach towards mental illness. Countries have made massive investments in social and community care services. And additional resources have been provided in general hospitals for mental health care. Germany, for example, has a community-based program where it provides mentally ill patients with financial support and helps them find work or retain their employment. Norway even has psychiatric casualty clinics at some hospitals. There are some interesting case studies emerging from Africa as well. An innovative program called Friendship Bench was adopted in Zimbabwe. The country has only 12 psychiatrists. So in order to tackle this problem of dearth of trained mental health professionals, grandmothers were trained in evidence-based talk therapy. They delivered cognitive behavioral therapy in a safe and comfortable environment outside the clinic grounds. The results were extremely encouraging, and prevalence of depression among the counsel groups reduced to a less than 10% in a 6-month period. India's lacunae vis-a-vis mental health care facilities and personnel also needs immediate attention. And one of the solutions lies in creating education opportunities in the mental health care arena. Sadly, as of now, there is an extremely limited curriculum of mental health care or psychiatry STEMs in medical colleges. Only 1.4% of lecture hours and a 2-week internship at medical school is what is available. We need to give much more emphasis to mental health education in our colleges and universities if we are able and if we are wanting to reduce the gap in the number of mental health professionals faster. Online courses is another way to increase and to reach the sustainability and help bolster the workforce and reduce care disparities. In conclusion, the SDGs are not just a goal for the government, for all of us, but for all of us in the private sector, the civil society, and the individuals. Another great initiative that we at Empower have started is a mental health curriculum, which we are now providing from grades 1 to grades 12. It is an initiative that we have just launched, and we're already seeing a lot of schools that are taking it. The objective of the initiative is to basically provide mental health literacy and to equip the children with the right coping mechanisms. When children, parents, and teachers become aware, when help-seeking behavior is encouraged, and when children start feeling empathetic towards themselves and the others who are suffering from mental health concerns, only then can the stigmas associated with mental health can be alleviated. I strongly advocate that every school must have a mental health curriculum that promotes this mental health literacy and equips them with the right coping mechanisms. In conclusion, I would like to say that the SDGs are a very important goals, like I said, not only for the government, but also for all of us in the private sector and individuals. The time has now come for us to decide our future course of action. The concept of the butterfly effect, which basically tells us that a butterfly beating its wings in Hong Kong can unleash a storm in New York. Small events can act as catalysts in great transformations. Our actions at this point in time will be like casting a stone into water. The ripples of these actions will be felt far and wide and for a long time to come. Whether it is in regards to eradicating poverty and hunger, providing clean energy and innovations, or revolutionizing cut. The ripples of these actions will be felt far and wide and for a long time to come. Whether it is in regards to eradicating poverty and hunger, providing clean energy and innovations, or completely drastically changing education and mental health, we have the power to make a fresh start. We can be the change makers if we can work towards the common goal of achieving our pledged SDGs. We can reshape the future for our next generations to come and build a more equitable and a just planet for all. Thank you all so much and have a wonderful afternoon.